Hi guys. A lot of new information has come out on COVID-19 since we did our original training in April. So the CDC has some new recommendations and the Morrow Home has implemented new interventions. So we've designed this updated COVID-19 response training so that we can all get caught up on the current recommendations for protecting each other and our residents from COVID-19. So I want to start with saying that this education was designed for the entire Morrow Home campus, but there is a lot of specific things to the nursing home on here. So in places where it asks you to notify me, I'm Mallory, I'm the director of nursing, or Emily. If you work in another area, if you work in assisted living, you'll want to contact Carrie Russell or the RN on call for updates for the assisted living residents. Of course, we are available if you have questions or you need help. But let's go through. A lot of this information is the same as the previous training. So bear with me on some of the redundancy, but the information that is the same is pretty pivotal stuff. So we're going to talk about our previous education on the COVID-19 pandemic, the disease prevention and safety, our updated Morrow Home community interventions, and some of the interventions that have been in place since March, what we're going to do with the COVID-19 positive staff cases, what to do if there is a COVID-19 positive resident case, and COVID-19 testing. So to review, we know at this point coronaviruses are types of viruses that are known to cause respiratory diseases in humans. So we've known about coronaviruses a long time. COVID-19 is an abbreviation for coronavirus disease 2019. It's also called SARS-CoV-2, and it's a new coronavirus strain that's causing pretty severe acute respiratory symptoms, especially in older people, and can result in complications like pneumonia and sepsis. We've seen other severe coronaviruses before. We saw SARS-CoV in 2003, and then we also studied the Middle Eastern Respiratory Syndrome, MERS-CoV, in 2012. The United States wasn't really super affected by MERS-CoV in 2012, but same kind of thing, same symptoms, so we have seen stuff like this before. COVID-19 is thought to spread mainly through close contact from person to person. Some people without symptoms may be able to spread the virus, and that is just taken from the CDC website, from the link that's there on the screen. You can go to any of these links for the most up-to-date information, and if you want to do your own research, I would encourage you to do that. Please go to the CDC website. You can also go to the state of Wisconsin, the DHS website. They also have information on coronavirus disease, and they have specific information as it pertains to nursing homes. So, close contact means sustained contact for more than 15 minutes and within 6 feet. So if you are in close contact without PPE for more than 15 minutes and within 6 feet of an infected person, that is an exposure. It may be an exposure regardless of the PPE you have on. The circumstances and the information surrounding that changes. We are seeing community spread, and it's likely that we will be in contact with people who are infected, especially people that don't know it yet. So, and that's because COVID-19 has a potential incubation period of 14 days. So most people show symptoms within 4 or 5 days after an exposure or contracting the illness. Some people don't. Some people it takes that 14 days to show up. So it's spread through droplet particles direct patient contact, and through indirect contact with infected surfaces. Although indirect contact is not thought to be the main way the virus spreads. It's actually now considered a lower risk than it was before when we did our training, but still there is a risk, especially for people with compromised immune systems. We don't know exactly how much of the virus it takes to infect somebody. So there's also information that it can be spread via the fecal-oral route, just like a lot of other diseases can. The symptoms, this is taken from the CDC's website that is listed there on your screen as well. And you can also go to this website and look up information about the symptoms and clinical presentation of coronavirus. But in general, these are the things that we're looking for. We are also screening our visitors and staff for loss of taste and or smell. That is a new thing that we've just added to our screening. It is thought to be a symptom of COVID-19. And for our residents, especially people who are severely immunocompromised, we might be looking for other symptoms too. It might not present, COVID-19 might not present clinically the same way that it would present in otherwise healthy people. It's rare, but there are occasions that have been reported where immunocompromised people might develop diarrhea and other GI symptoms prior to becoming, or prior to the other respiratory symptoms that are typical of coronavirus or COVID-19. So really, we just want to look for changes in our residents and make sure that we are taking appropriate action, because COVID spreads really quickly in communal living areas like nursing homes, cruise ships, places with shared ventilation, and that's the situation that we have. And age and comorbid conditions are a big predisposing factor to getting a very severe case of the disease. So the older somebody is and the sicker somebody is, the more likely they are to develop severe symptomatic infection with a higher mortality rate. So although there's lots of stuff out there, and I know that there's a lot of memes and a lot of things on Facebook and a lot of things out there on the internet that are saying the mortality rate for COVID-19 is 0.2% or that it's very, very low. But for our people, for residents, for people that are over 80 years old especially, that mortality rate is still about 14%, and that is a really high mortality rate. And even so, even if the mortality rate was 0.2% out of 7 billion people in the world, that would be 140 million deaths. So it's a risk, and it's severe, and we should treat it like it is. So the complications of COVID-19 are generally sepsis, which is a systemic infection throughout the body, and pneumonia. Usually pneumonia causes the sepsis. You can also have respiratory failure, septic shock, cardiomyopathy, arrhythmias, kidney injuries. So it can lead to some very severe things in our folks. And again, follow the link if you want some more information. So we do have a plan. Morrow Home Community has a plan to protect our residents and our staff, which that plan involves following the CDC guidelines, completing staff screening, doing resident monitoring, putting new admissions on isolation and droplet precautions, doing hand washing, educating on hand washing, using appropriate personal protective equipment, reducing and eliminating, if possible, ER and hospital visits, doing additional facility cleaning, consistent staff assignments, the design of our isolation unit on first floor west wing in the nursing home, and staff and resident testing. Staff and resident testing is a pretty new intervention that was not covered in our April education, so we are going to cover that in this one. This slide, this information is review. We have already stopped all communal dining activities and unnecessary visits and visitors, with some exceptions being for compassionate care visits. So we know that our community, Monroe County, has been affected by community spread, which means that there's people in our community that have COVID-19 and don't have any known exposure to another confirmed case. So people are out there potentially spreading this virus that are infected, that have no symptoms or very, very mild symptoms, but it could be a very big deal for someone else to contract it. So the asymptomatic infected people are a really high risk for us. It's important that we can identify early signs of illness so we can put interventions in place to protect everyone, like putting people on droplet precautions or changing the PPE that we use. So staff are probably less likely to become severely ill from COVID-19 and the symptoms of the disease. It might be mild, but even a person with mild or no symptoms can spread this disease, and that could be deadly for our residents. So please, when you come in through the designated entrances, complete the screening, make sure that if you're sick, you don't stay here. You may not work. And then, of course, resident monitoring. A lot of our residents have chronic and comorbid conditions and can get sick really quickly. So we're checking for fever, oxygen, respiratory status. We want to make sure that if there's a change, we take action, put on precautions, and transfer the resident after testing if needed. So if a resident develops respiratory symptoms, stop what you're doing and ask for help if you have to. That resident has to be placed on droplet precautions, and that needs to be done immediately. So call your supervisor or call the RN on call to let them know. And if you're calling myself or if you're calling Emily, the infection prevention RN, we will go through assessments and next steps with you. So I know that we've watched the hand washing videos before, but it's still, hand washing is the #1 line of defense at preventing the spread of disease, all disease. And COVID-19 is not an exception to that. So we are going to go ahead and watch this video on hand washing, and we're also going to watch the video on hand sanitizer.
Today we're going to review basic hand washing just as a nice reminder. Hand hygiene should be performed anytime prior to putting gloves on, after taking gloves off. The first step is turn the water on, get your hands wet, apply some soap. And we all know that the correct amount of time to scrub your hands is 20 seconds. Paying close attention to getting the fingertips around the back of your hands, around your thumbs. Those areas are frequently forgotten. In between your fingers, if you have a wedding ring on, minimal amounts of jewelry are okay. So you can sing happy birthday 2 times, you can say the alphabet. There's a number of songs out there right now. And there's my 20 seconds, so I'm going to finish up. Water doesn't have to be hot, warm is fine. Get them nice and rinsed. Always let the water kind of drip down. You don't want to shake it too much. Paper toweling. Dry your hands off. Grab another paper towel and shut off the faucet. Once you've completed all of that, you are good to go. Okay guys, second part of our hand hygiene is using alcohol-based hand sanitizer. I love it, it's awesome. It's everywhere in our facility. I don't care if you use your own from Bath & Body Works or Walmart, as long as it has 60% alcohol. That is the only really important thing to know. So after you take your gloves off or before you put them on or any time in between contact, you want to go ahead and 1 squirt of hand sanitizer, about a dime size, and you're just going to apply that, rub it all over your hands, in between tops and bottoms, until it dries. Doesn't take long because the amount of alcohol obviously evaporates pretty quickly, and then you're good to go.
So we already know that COVID can spread both directly through the droplets of an infected person and through surfaces. So basically, the bottom line is that clean hands don't spread bacteria from one person, one patient to another. And you're a lot less likely to acquire the disease if you have clean hands. So if you need supplies for hand hygiene, they are available. If you run out of soap in a room or sanitizer refills or paper towels, please contact your housekeeping department to have those things replaced. There's also hand sanitizer bottles and stuff that you can carry around, put in your pocket, and you can use those. So personal protective equipment also playing a key role, and there are some changes to what we're going to be doing with that too. Currently, all staff are wearing surgical masks at all times when at work. Staff are also going to be required to wear face shields or goggles at all times when at work moving forward. So the face shields and goggles is new, and it does protect both the wearer and the residents from getting this infection, just because it blocks off more of your face, more of where portals of entry where you could become infected if someone coughs or sneezes on you, or if you touch a surface that's infected and then touch face. So we hope that it prevents people from touching their faces. We hope that it also helps in general with correctly donning and doffing PPE. And it just offers an extra layer of protection for everyone. So, additionally to the personal protective equipment, droplet precautions are required for new admissions, readmissions, anyone with symptoms of a respiratory illness. They might be required for residents presenting with other atypical symptoms of some sort of infection or changing condition at the direction of the infection preventionist or your supervisor. Nursing home staff, if you need more PPE, it is available in the green room across from Emily B's office, and the medication rooms have some of the PPE in them. Any nurse can access that green room using a master key. If what you need is not available, please contact me, Emily, or Mariah right away, and we'll get you what you need. Assisted living staff, if you need more PPE, if you run out, it is available in the Bridge Path basement storeroom. And if you don't have something that you need, please contact your supervisor or the RN on call for help. So we are going to watch, I know that we've watched this video before, but we are going to watch the video on droplet precautions, donning and doffing the PPE. And Hillary is such a fantastic model during this video.
Hi guys, today we're going to run through on the correct way to put on your PPE and to take off your PPE as safely as possible. Hillary is our demonstrator today, so the first thing that you do when you're going to enter a room that requires PPE is hand hygiene. So Hillary, go ahead and do some hand hygiene. Alcohol-based hand sanitizer or hand washing for 20 seconds is appropriate. The next thing after your hand hygiene is complete is going to be to put your gown on. So once that sanitizer is dry, so we'll have you put a gown on. That gown is going to open in the back. So slip your arms in. The ties are in the back. There you go. Perfect. This can get a little tricky to tie it in the back, but go ahead and do your best. While Hillary's getting her gown tied up, there are two different types of face masks that potentially would be available for our residents requiring droplet or airborne precautions. An N95 mask, which is a higher level of protection for the person wearing the mask, is only going to be used in the cases of confirmed COVID-19 patients. Otherwise, yep, this is an example of an N95 mask. Otherwise, a surgical mask, the standard mask that we use for any type of droplet precautions. Go ahead and put that on. Make sure it fits good over your nose and your chin. Squeeze it tight. Got a good fit. The next thing, which is a little bit different for what we're used to, is going to be eye protection or a face shield. So go ahead and put on your eye protection just in case of a splash or spray. And then gloves is going to be the very last thing that you do. And when you put your gloves on, you're going to want to make sure that the cuff of the glove covers the cuff of your isolation gown the best that it can to limit any exposed skin or clothing. Once you have completed full PPE donning, which includes gown, glove, mask, and eye protection, you can go ahead and complete your resident cares as you would. And when you're ready to exit the resident room, the first thing you're going to do, once you're 6 feet away from your resident, is remove your gloves by pinching the glove and removing it, and then going under the cuff, just like that. It's okay. And then just let it go. There you go. Put them in the garbage can. Perfect. Next thing that you're going to want to remove is your goggles, and you're going to want to take them straight off your face and deposit them in the dirty area. Then you are going to remove your gown. So you're going to need to untie, taking care not to touch the front of your gown with your hands. If your hands become contaminated at any time during this process, go ahead and do another level of PPE or hand hygiene. So go ahead and remove your gown, Hillary, from the back and just peel it off so it's inside out. Perfect. Then you would roll it and put it in the laundry bin. In this case, it's disposable. It will go in the garbage. Now you perform hand hygiene. Perfect. Just great. Step out of the room and remove your mask. In the event that you're using an N95 respirator, those masks will be used multiple times over and over. You will not throw them away. For the time being, a standard ear loop mask is a one-time only mask. If you have any questions about donning or doffing your PPE or how to safely do it or anything else that comes up, please ask myself, Mallory, or Jen. Thanks, guys.
So one thing I just wanted to add real quick about the face shields or the goggles that we're going to be wearing is that you will pick those up just like you pick up your mask when you come to clock in. And then you will, when you leave, please exit through the same way, and you can deposit those goggles or the face shield into a bin so that they can be sanitized. Just wanted to point out this sign will be on the door of a resident's room if they are on droplet precautions, and there will be a date at the bottom of this sign that tells you when the resident can come off of droplet precautions. So because people can carry and spread COVID-19 before they have symptoms, the masks and face shields offer protection to residents and employees if staff are wearing them at all times by containing the virus to the infected person. So we're wearing surgical masks at all times when we're in the building, and that protects other people from us if we are infected and don't know it. And then by placing all newly admitted residents on droplet precautions, we're protecting employees and other residents if the newly admitted resident has COVID-19 but is not yet showing any symptoms. So before we admit a resident to our facility, we are requiring a swab for COVID-19. But because the incubation period is 14 days, it is possible that the resident, even after an exposure, could test negative on that initial test because the viral load is low. And then later, as the virus has a chance to spread through their body, they could develop symptoms and test positive. We don't know. And we have no way of gauging at this point, because there are asymptomatic carriers, whether or not a resident has truly been exposed. So All newly admitted residents will be on droplet precautions for 14 days. N95 respirators will be used in the case of confirmed COVID-19 because during aerosolizing procedures like nebulizer treatment or O2 application, CPAP or BiPAP use, the virus can become airborne, and the N95 respirator will help filter out those viral particles so that you don't breathe them in and become infected, if that's the case. So another thing that we're trying to do to limit exposure and stop the spread in our facility is to reduce ER and hospital transfers. So please assess your residents, report changes in condition, notice changes in condition early. We have a lot of things that we can do here in skilled nursing. We can do in-house diagnostics, labs multiple times a day if needed. We have mobile x-rays, we can do mobile EKGs, we can do IV hydration, stat medication, strict I&Os, oxygen, antibiotics. We can do a lot. So please make sure that you're offering those alternatives and trying to treat residents in-house if possible. Emergency rooms are not controlled environments, so the risk of exposure is a lot higher if you're sending a resident to the ER as opposed to treating them in the nursing home. So if a resident's needs can be met here, we should do everything possible to meet them and reduce that risk of exposure. So another part of our plan is facility cleaning. Housekeeping is doing extra cleaning. Isolation rooms are cleaned twice a day. Every room we are focusing on touch points like the bedside table, side rails on the beds if people still have those, or grab bars on the beds, grab bars in the bathrooms. All of our cleaning products have been verified using the CDC link for EPA registered cleaning products. So nursing staff, please make sure housekeeping and facility cleaning is everyone's responsibility, not just the responsibility of housekeepers. So, and they are not here 24 hours a day. So please make sure that you're using the wipes and the green canisters to wipe down lifts and vitals machines between use. You can use alcohol swabs to clean the pulse oximeter machines and stethoscopes between use. If a resident's on precautions, they'll have a bag of supplies in their room or hanging on their door so that you don't have to transfer that equipment to other people. But still, even well residents, as we know, there's asymptomatic infections. Even well residents we could transfer germs to other people. So make sure you're cleaning your equipment, your lifts, your vital stuff, anything that you're going to use on more than one person. Please clean it every time. Also, if a compassionate care visit is authorized by myself or Jen Brisky, the administrator, or Carrie in assisted living, the rooms need to be sanitized after visitors leave. And you can do that using the products that we have. You have access to the janitor's closet that has the cleaners, some of the cleaners in it, and you also have access to those hydrogen peroxide wipes. So in addition to the cleaning, it's important that we know how long it takes to kill the virus that we're looking to kill. So the contact time or kill time is the necessary time for a surface to remain wet to kill the desired pathogen. And the common time for a water-based disinfectant to dry is 1.5 to 2 minutes. So if a longer wet time, contact time, or kill time is required, say 10 minutes, you will have to wipe down that surface multiple times with the disinfectant that you're using to maintain a wet surface for the desired amount of time. These are the products that we have, that our housekeeping department has, and we have access to, what they're used for, and the contact time. So the Clorox wipes are very easily accessible, and that kill time is 2 minutes. So it's likely only to require just one wipe down for that, for it to work to kill the COVID-19 virus. So Clorox bleach wipes, 3 minutes to kill COVID-19. The Clorox bleach spray has a contact time of 1 minute, and Clorox cleanup also has a contact time of 1 minute to kill the coronavirus. So we do have some very good products to use to clean our facility and mitigate the spread. If there's a positive resident case, this is review. We know what we need to do. Stop what you're doing. Don full PPE. There are kits with N95 masks available in the nurses' stations with the full PPE. Clear the hallway of the residence, put a mask on the infected resident, and get the resident to first floor West Hall. Don't take any of their belongings with them. Their coronavirus can live on surfaces, and the point of transferring the resident is to transfer them to a unit that is clean, that has some negative pressure, and can be isolated. The ventilation is isolated from the other parts of the building. So notify Emily or me right away if you have a resident with a positive case, or Carrie Russell, and check the policy. There is a pandemic policy and there is a checklist for the nursing home. I will show you how to do that, on how to staff that unit if it is activated. If there's a positive staff case, which is true right now, then the positive case will be asked to remain at home for at least 10 days. And there's also a test-based strategy. So if there is a positive staff case, Emily is going to contact you and tell you what to do. She will be monitoring your symptoms, and the public health department will also be in contact with you. Important things to note: if you're at work feeling sick, please leave. I know that we tell you upon hire and all the time that you absolutely cannot walk off the job, but right now I am going to change that a little bit and ask you that if you are at work and you come down with an illness while you're working, if you start coughing, if you start feeling fatigued, really fatigued, if you have a lot of muscle pain, if you have respiratory symptoms, you need to get out of the building and call your supervisor once you get out to tell them what's going on. We will probably refer you to test if that is the case. If you come in for the start of your shift and you answer yes to any of the screening questions that are on there, you can't work, and you might be referred for additional testing then also. Really, like I said, some of these symptoms, some of these infections can be very mild. So while you might think you just have a regular cold, that could not be the case, and it could be deadly for the residents in our facility. So that's why we really have to be careful with this. We're going to look at attendance points and stuff like that on a case-by-case basis. You will absolutely not be penalized if you develop this infection and we have to have you stay home. So if you have been in close direct contact, so greater than 15 minutes and within 6 feet of an infected person, you might be asked to self-isolate at home for 14 days. So information on this is changing. Return to work guidelines are changing. So I might tell you that we will absolutely ask you to self-isolate at home for 14 days, and then some crisis happens and those rules might change. Right now, just want you to know that if you have been in close direct contact with a positive person, it is likely you will be isolating at home. We are going to start doing staff and resident testing. The Morrow home community will be testing residents and staff every 2 weeks. The results are going to be communicated to you by your supervisor. So staff who test positive are going to be asked to isolate at home for at least 10 days. Residents who test positive are going to be transitioned to the isolation unit for continued care, or based on symptoms and goals of care might be hospitalized. If a resident tests positive, testing frequency is going to be increased from every 2 weeks to every week. As always, if you have questions, please contact your supervisor. You can contact me, you can contact Emily, you can contact Jen. Carrie and Karen are also good resources for you guys in assisted living. So please just make sure, if you have questions about the video, if you have questions about something that you read about the coronavirus, anything, we want you to be as informed as possible. So please let us know. We'll help you through it. All right, and the quiz. So, what symptoms did we recently add to our visitor and staff screening tool? Is it cough, sore throat, fever, or loss of taste or smell? And the answer is loss of taste or smell. So we've been screening for the other things since we started screening. This is review. COVID-19 has an incubation period of how many days? And the answer is 14. So this means a person can have an exposure and contract the illness and not show any symptoms for 14 days. Although most people, I think it's 95% of people, show symptoms 4 to 5 days after contracting the illness, and 97.5% of people show symptoms within 11 days of contracting the illness. But there are those 2.5% that that have 14 days before they develop symptoms. And so that's why we are asking, if you have an exposure, that you self-isolate at home for 14 days. Also, you may have an exposure and test negative within that 14-day period, but you still cannot come back to work because we do not know what the viral load is. And it's possible to test positive after an exposure, even after you've tested negative for it. So please just make sure that you're staying safe, that you're self-isolating, and that you're doing what you're supposed to do. So question, where can you find PPE if you run out? The nursing home staff can find additional PPE in the medication rooms and the green room across from Emily B's office. Assisted living staff can find additional PPE in the Bridge Path basement storeroom. When residents are infected with COVID-19, they will always present with the same sets of symptoms. That's false. Residents who are already immunocompromised might present with different symptoms and a different severity of symptoms. Not all cases are the same. Coronavirus may be spread through coming into contact with the droplets produced by an infected person after they sneeze or cough, touching a surface with living virus on it, and then touching your eyes, nose, or mouth, being in close proximity to other infected people in communal settings where the virus may be living suspended in the air. And the answer to that is all of the above, which is why hand washing, wearing a mask, wearing the face shield, and staying home whenever possible are the best ways to ensure you reduce your risk of contracting and spreading the virus. So even though the CDC has come out and said it's not very likely that you will touch a surface and become infected that way, it's still possible. And we have the vulnerable population. We want to make sure that we're doing everything possible. So even if the risk is low, we want to prevent infection. So why is it important for staff to wear a surgical mask and a face shield while at work? A face shield, in addition to face masks, provides protection to both the wearer and others in the event there is close contact with an infected person. Or nursing management at Morrow Home loves wearing extra PPE in the hot summer months, and we want to share that joy with others. And the answer is obviously A. The face shield, in addition to the surgical mask, provides protection to both the wearer and to others in the event there's close contact with an infected person. In what order does a person don or put on droplet PPE? So these posters are also posted next to the rooms of residents who are on isolation precautions, and it shows you how to put on PPE and the order in which to put it on. So first you will put on a gown, second you will put on your mask, third your goggles or face shield, and fourth your gloves. Now, because we are going to be wearing goggles all the time or a face shield all the time, you will not need to take that off unless it is visibly soiled. So you can go from room to room with that same face shield on. What order does a person doff or take off droplet PPE? And the answer is the posters are also posted by all of these rooms. Take your gloves off first. Goggles would be second, but you're not going to remove those now. But goggles would be second. Your gown is third, and your mask is fourth. And then obviously wash your hands. And we know that communal dining and activities should be stopped because disease is more likely to spread rapidly if people are close together. If I have questions about COVID-19 or ways to protect myself and my residents, I should consult. This is a repeat question. I just want to make sure y'all are paying attention. Please contact me and Emily or Jen, Carrie, Karen, your supervisor. We will use reputable sources. We will use the Centers for Disease Control and Prevention, the World Health Organization, the American Medical Directors Association, and the information from the state of Wisconsin and CMS, so that we are giving out accurate and up-to-date information at all times. Please don't get your coronavirus education through Facebook. I can direct you to appropriate websites. I can give you resources. If you want to do some of your own research, I can direct you to the places where you can do that. Also, please don't go to the friend who's a conspiracy theorist or the essential oils reference guide. Although I have a great respect for essential oils, this is probably not the time to be referencing that particular book. So, thank you for completing this training. I know it was a long one. The information is really important, especially now that we have a positive staff case. We just want to make sure everyone stays up to date, everyone stays safe, and we mitigate the risk of the spread of this infection as much as possible. So, thank you.